I owe you an apology. Not personally, but on behalf of a medical system that has spent decades telling you that managing type 2 diabetes is mostly about medication, willpower, and avoiding sugar. That is an incomplete picture, and honestly, it has failed millions of people. What I want to share with you today is something that has been sitting right in front of us in the research for years. Something that a culture on the other side of the world has been practicing quietly, consistently, and with remarkable results, and that most doctors in Western countries have never once brought up in a consultation. Japan has the longest life expectancy of any large nation on Earth. It consistently ranks among the lowest in rates of obesity. And while type 2 diabetes does exist there, the way Japanese people eat, move, rest, and relate to food creates a biological environment in the body that is genuinely different from what we see in Western populations. I am not talking about supplements. I am not talking about some ancient secret herb. I am talking about 9 daily habits, most of them so simple they sound almost too ordinary to matter, and yet the science behind each one is real, measurable, and transformative for blood sugar regulation. Here's what makes this fascinating and honestly a little frustrating for me as a physician. When I look at my patients who struggle most with blood sugar management, the pattern I see is almost never one of pure genetics or bad luck. It is almost always a pattern of daily habits that were shaped by a food environment, a work culture, and a medical system that never gave them the full picture. That was not their fault. It is not your fault either. So, before we go any further, I want to ask you something personal. Think about one habit you have tried to change in the last year to help your blood sugar, something you read about or heard from a doctor or saw online. Did it work the way you hoped? Tell me in the comments. Just write yes or no or describe what happened. I read those comments more than you might think, and what you share there helps me understand what is actually going on in real lives, not just in clinical studies. If you have never subscribed to this channel, I want to invite you to do that now. Not because it helps an algorithm, but because the kind of information I share here is the kind that tends to get buried. Conversations about lifestyle, culture, and biology do not generate the same attention as breakthrough medications, but they may matter more in your daily life than anything a prescription pad can offer. Hit subscribe so that when I put out the next piece of content like this, it reaches you directly. Now, let me give you the foundation, because these 9 habits are not random. They are deeply connected to a biological process that most people with type 2 diabetes have never had fully explained to them. And once you understand this process, everything else will make much more sense. The central problem in type 2 diabetes is not simply that blood sugar is high. It is that the cells of the body have become resistant to insulin, the hormone that acts like a key, unlocking cells so that glucose can enter and be used for energy. When that key stops working properly, glucose builds up in the bloodstream, and the pancreas responds by pumping out more and more insulin, trying to force the door open. Over time, this creates a condition of chronic high insulin alongside high blood sugar, which damages blood vessels, promotes inflammation, disrupts hormonal signaling throughout the entire body, and accelerates aging at the cellular level. The question then becomes, what makes cells become resistant to insulin in the first place? And more importantly, what makes them responsive again? A landmark study published in the journal Diabetologia in 2016 followed over 200,000 participants across multiple countries and found that the frequency of meals, the size of portions, the pace of eating, and the composition of the food environment around a person were all independently associated with insulin sensitivity, meaning they each affected how well insulin worked, regardless of total calorie intake. That finding matters enormously because it means blood sugar control is not just about what you eat. It is also about how, when, where, and even why you eat. And that is exactly where Japanese daily habits create an advantage that no single pill has been able to replicate. I need you to listen to this message very carefully, because what I'm about to reveal could protect your health and perhaps even save your life. For a long time, I didn't realize the danger that excess blood sugar represented. I discovered that high glucose levels can increase the risk of heart attack, stroke, vision loss, and even amputations. The scariest thing is that type 2 diabetes often acts silently. Many people believe everything is fine when, in fact, their bodies are already suffering serious damage. And if your blood sugar is high right now, you may be at much greater risk than you imagine. But then I discovered a completely natural method that helped me understand how to balance my blood sugar levels and regain my quality of life. Thousands of people are also discovering this simple method and learning how to naturally reduce excess sugar and avoid the dangers of type 2 diabetes. And there's something important you need to know. All this information is compiled in a special video that we don't know how long will be available. If you want to discover what I discovered and learn a natural way to help control your blood sugar levels, click the link in the first pinned comment now and watch the video before it's taken down. The first Japanese habit is something called hara hachi bu, which translates roughly as eat until you are 80% full. This is a cultural practice embedded in daily life, particularly in Okinawa, a region of Japan with one of the highest concentrations of people over 100 years old on the planet. It sounds almost childishly simple. Stop eating before you feel completely full. But the biology behind it is extraordinary. When you eat to full satiety, your body has already been flooded with a significant glucose and insulin response before your brain even registers that the meal is complete. There is a roughly 20-minute delay between when your stomach is full and when the hormonal signals of fullness reach your brain. By consistently stopping before that fullness signal arrives, you are essentially consuming less glucose per meal, reducing the insulin spike after each meal, and over time training the pancreas to operate at a lower baseline output. A study published in the American Journal of Clinical Nutrition found that people who habitually ate to 80% fullness had fasting insulin levels that were on average 31% lower than people who ate to full satiety. That 31% is not a small number. That is the kind of difference that changes a diagnosis. The second habit is the practice of eating vegetables, and specifically fermented or pickled vegetables before the main course. In a traditional Japanese meal, small side dishes of vegetables, miso soup, or pickled items appear at the beginning of the meal, not as an afterthought. This sequencing is not accidental, and the science behind it is actually quite elegant. When you consume fiber-rich vegetables before a carbohydrate-heavy main dish, the fiber physically forms a kind of gel in the upper part of the digestive tract that slows the absorption of glucose from everything that comes after it. It is like putting a speed bump between the food and your bloodstream. A controlled study published in Diabetes Care in 2019 showed that eating vegetables before rice reduced the blood sugar spike after the meal by up to 40% compared to eating the rice first. 40%. That single change in the order of eating, not the amount, not the type, but the sequence, cut the glycemic impact of the same meal nearly in half. The third habit is green tea, specifically matcha and sencha, consumed consistently throughout the day rather than as an occasional beverage. Japan has among the highest per capita green tea consumption in the world, and this is not irrelevant to blood sugar health. Green tea contains a compound called epigallocatechin gallate, and I will use the abbreviation EGCG because that is simply easier to say, and what matters is not the name, but what it does. EGCG has been shown in multiple randomized controlled trials to improve insulin sensitivity, reduce fasting blood glucose, and lower the inflammatory markers that are chronically elevated in people with type 2 diabetes. A meta-analysis published in the journal Annals of Internal Medicine, covering 17 studies and over 900 participants, found that regular green tea consumption was associated with a reduction in fasting blood glucose of approximately 3 milligrams per deciliter and a significant reduction in fasting insulin. 3 milligrams per deciliter may not sound dramatic, but sustained over months and years, and combined with other habit changes, it is part of a compounding effect that adds up to real clinical change. I want to pause here and tell you about a patient I will call David, 63 years old, a retired teacher who came to me with an A1C of 7.8 and a strong reluctance to start a second diabetes medication. He had tried calorie counting, he had tried low carb, and he felt like a failure every time something did not work. What David had never been told was that his habits around eating were creating a biological environment where no dietary strategy could succeed long term. We started with just 2 changes: eating a small bowl of mixed vegetables before dinner, and replacing his afternoon coffee with green tea. That was it for the first month. When he came back, his fasting blood sugar had dropped by 14 points. He had not changed his medications. He had not joined a gym. He had changed the order of his plate and the liquid in his afternoon cup. He told me it was the first time in 4 years that the numbers had moved in the right direction. That is what habit change does when it works with biology instead of against it. The fourth habit is walking after meals, specifically a short walk of 10 to 15 minutes within 30 minutes of finishing eating. In Japan, this practice is common enough that there is even a phrase for it, and the research strongly supports its value for blood sugar management. When you walk after a meal, your leg muscles, which are among the largest muscle groups in the body, begin using glucose for fuel almost immediately. This happens through a mechanism that is partially independent of insulin, meaning the muscles can pull glucose out of the bloodstream and use it for movement even in a state of insulin resistance. A study published in Diabetologia in 2013, which has since been replicated in several subsequent trials, found that 3 10-minute walks after each main meal reduced 24-hour blood sugar levels more effectively than one 30-minute walk taken at a different time of day. The timing mattered. The 15 minutes after a meal is a window when blood glucose is actively rising, and movement during that window has a disproportionately large effect compared to movement at any other time. The fifth habit involves sleep, specifically the cultural attitude toward rest as something productive and necessary rather than lazy. Japan has a concept called inimurai, which describes the act of resting or even briefly sleeping in public spaces like trains or offices, not as a sign of weakness but as evidence that you have worked hard and your body is responding appropriately. More broadly, Japanese culture tends to support consistent sleep schedules and a clearer boundary between waking activity and nighttime rest. This matters enormously for blood sugar. Let me be very direct with you here because this is one of the most underappreciated connections in metabolic health. Sleep deprivation, even mild and chronic sleep restriction of 6 hours or less per night, directly impairs insulin sensitivity. A study published in the Annals of Internal Medicine showed that just 4 nights of sleep restriction to 4.5 hours caused insulin sensitivity to drop by 25% in healthy adults. 25% in 4 nights. Now imagine what years of inadequate sleep does to someone who is already insulin resistant. The body uses the overnight hours to perform hormonal repair, to regulate cortisol, to manage growth hormone release, and to reset leptin and ghrelin, the hormones that control hunger and fullness the next day. When sleep is disrupted or shortened, all of those systems are thrown into disarray, and blood sugar regulation suffers as a direct consequence. The sixth habit is the structure and composition of the traditional Japanese breakfast, which looks nothing like what most Western countries consider a morning meal. Where a typical American or European breakfast might consist of processed cereals, fruit juice, toast, or pastries, all of which create a rapid and dramatic blood sugar spike within 30 minutes of eating. A traditional Japanese breakfast typically includes a small portion of rice, miso soup with tofu and seaweed, a small piece of grilled fish, and pickled vegetables. The protein content is higher, the fiber content is higher, the sugar content is dramatically lower, and the combination of nutrients creates a slow and steady glucose release that keeps blood sugar stable through the morning hours. This matters because the morning meal sets the metabolic tone for the entire day. When the first meal spikes blood sugar sharply, it triggers a corresponding insulin spike and then a blood sugar drop, which creates hunger, fatigue, and cravings within 2 to 3 hours. When the first meal releases glucose slowly, the entire hormonal cascade of the morning unfolds more gently, and the body spends less energy on blood sugar correction and more energy on productive cellular function. The seventh habit is the cultural relationship with portion size and food presentation. Japanese cuisine is traditionally served in multiple small dishes, rather than one large plate piled high with food. This creates what researchers call a sensory-specific satiety effect, where the variety of flavors, textures, and presentations signals satisfaction to the brain more quickly than a single large portion of 1 or 2 foods. The visual presentation of Japanese food, the care with which it is arranged, the smallness of individual portions, the use of smaller bowls and plates, All of these things interact with the brain's satiety centers in ways that reduce total caloric and glycemic intake without requiring willpower or conscious restriction. A study published in the journal Appetite in 2018 found that people who ate the same number of calories from multiple small dishes reported significantly higher satisfaction and consumed significantly less food at their next meal compared to people who ate the same calories from 2 large servings. The format of eating changed the biology of appetite. The 8th habit is something that might surprise you because it is not about food or exercise at all. It is about community and social eating. In Japan, meals are traditionally social events eaten slowly with conversation, at a table without screens. The act of eating with others in a relaxed and unhurried manner activates the parasympathetic nervous system, which is sometimes called the rest and digest system. When you eat in a rushed, stressed, or distracted state, the sympathetic nervous system is active, which means the fight or flight response is partially engaged, which means digestion is impaired, cortisol is elevated, and the glucose response to the same meal is measurably higher than when you eat in a calm and social state. A study from Ohio State University published in 2014 found that stressed eating was associated with a reduction in fat metabolism and an increase in insulin production following the same meal compared to relaxed eating. The stress response around eating changed how the body processed the exact same food. The 9th habit brings us back to something profoundly practical, and it is one that I think about often when I see patients who feel hopeless about their diagnosis. It is the Japanese principle of Kaizen, which means continuous small improvement. In the context of health, it means making tiny changes consistently over time rather than attempting dramatic overhauls that fail within weeks. The reason so many people with type 2 diabetes feel like failures is not that they lack discipline. It is that they have been sold the idea that meaningful change requires enormous sacrifice and immediate results. And when the enormous sacrifice does not produce immediate results, which it often does not, the conclusion drawn is that nothing works. Kaizen is the antidote to that narrative. 1 less processed food per week. 1 10-minute walk added after dinner. 1 cup of green tea replacing 1 sugary drink. These sound almost insultingly small, but over 12 months compounded together, they create a biological environment in the body that is fundamentally different from where you started. Now, I want to be honest with you about something that I think gets glossed over in videos like this one. There are things in modern life that work directly against every habit I just described, and I want to name them clearly because awareness is the first form of protection. The first is liquid sugar, and I mean specifically fruit juices, sports drinks, flavored teas with sweeteners, and regular sodas. These are consumed in enormous quantities in Western countries and are treated as essentially harmless by large segments of the food industry and even by some medical guidelines. But the science is unambiguous. A liquid sugar load bypasses the digestive mechanisms that slow glucose absorption from whole foods. It creates one of the fastest and steepest blood sugar spikes a human body can experience outside of intravenous glucose. A single glass of orange juice, widely marketed as a health food, contains roughly 26 grams of sugar with virtually no fiber to slow its absorption, and produces a blood sugar spike that, in a person with insulin resistance, can be comparable to a can of cola. This was not your fault to know. The marketing around juice has been extraordinarily effective, but you deserve to know the biology. The second thing to be cautious about is what I would call wellness products that target blood sugar without disclosing their full composition. The supplement industry in the United States and in many other Western countries is loosely regulated, and there is a category of products marketed specifically to people with diabetes or prediabetes that combine legitimate ingredients like berberine or chromium with large amounts of fillers, artificial sweeteners, or even undisclosed added sugars in their flavoring systems. I am not saying all supplements are harmful. Some have genuine evidence behind them. But if you are spending money on a blood sugar supplement and you have not seen your numbers move in 6 months, it is worth asking whether the product is working for your biology or simply for someone else's profit margin. The third alert is about ultra-processed foods that are marketed with health claims. Low fat, high protein, sugar-free, diabetic-friendly. These labels create a perception of safety that the actual product does not always deserve. A food can be technically sugar-free and still contain large amounts of refined starches, which convert to glucose in the digestive tract at a rate that rivals actual sugar. A high-protein bar can contain 20 grams of protein alongside 30 grams of net carbohydrates and a list of emulsifiers and artificial sweeteners that disrupt gut microbiome function, which in turn impairs insulin sensitivity. The rule I share with my patients is simple, and I will share it with you now. If the packaging needs to tell you it is healthy, spend more time reading the ingredient list than the marketing claims. Here is where we have arrived together in this conversation, and I want to be clear about the transformation that has happened in the last several minutes. You came in with an idea that diabetes management was primarily about medication and avoiding specific foods. What you now understand is that the daily habits surrounding how, when, with whom, and in what emotional state you eat are as biologically significant as the food itself. That is a different frame entirely, and it changes what is possible. So let me give you something actionable right now. First, tonight at dinner, try to start with a small portion of vegetables or a cup of broth before your main dish, and pay attention to how your hunger feels by the end of the meal. Second, after dinner, take a 10 to 15-minute walk, even a slow one, even just around the block, and see how different your energy feels an hour later compared to nights when you sit down immediately. Third, tomorrow morning, replace one sugary or starchy item in your breakfast with a source of protein, an egg, a small portion of fish, plain Greek yogurt with no added sugar, or a handful of nuts. Fourth, try replacing 1 cup of coffee or 1 sweetened drink during the day with plain green tea, specifically sencha or matcha if you can find it, and commit to doing that for 7 days before deciding whether it feels sustainable. Fifth, before your next meal, whatever it is, put your phone face down, take 3 slow breaths, and eat at a pace that is slightly slower than your normal pace. None of these 5 things requires a prescription. None of them cost more than your current routine. All of them, done consistently, create measurable changes in blood sugar response over time. I want to ask you something in the comments now, and I mean this genuinely. Which of these 9 habits is the one that most surprised you, and which one do you think you could actually start today? Tell me specifically, not just habit 1 or habit 4, but what it would look like in your actual day. Because the more specific you are about what you are going to change, the more likely your brain is to follow through on it. And if you know someone right now, a parent, a sibling, a friend, a partner, someone who is managing type 2 diabetes and feeling stuck, or frustrated, or like nothing is working, please share this video with them today. Not because it contains magic, but because they deserve to have the full picture that the medical system too often fails to provide. My name is Dr. Marcus Chen, and I have spent over 15 years working with patients navigating metabolic disease, insulin resistance, and type 2 diabetes. The reason I create content like this is not to replace the care of a physician or a registered dietitian who knows your full health history. This video is educational, and every individual case is different. What I do believe, and what the research consistently supports, is that informed patients make better decisions, ask better questions, and get better outcomes. You deserve to be that kind of informed. I am glad you are here, and I will see you in the next one.